Examination of the uterus in the sagittal plane. I then introduce the probe in the sagittal plane. Optimize an image of the uterus. In sagittal plane, I now demonstrate a view of the uterus in its midline. If necessary, I adjust the depth of field, then the zoom, to ensure that the uterus is centralized and occupies between 40 and 60% of the field of view. I then optimize the gain to achieve an even image throughout the depth. I then freeze the ultrasound image. I capture an image and unfreeze the ultrasound image. Examine the uterus in the sagittal plane. I slowly angle the probe towards the patient's right, scanning through and beyond the lateral margins of the uterus. Then slowly angle the probe towards the patient's left, scanning through and beyond the left lateral margins of the uterus. Throughout the scan, I demonstrate a regular continuous outline of the uterus. I ensure that I do not apply too much pressure to the patient. Optimize an image of the endometrium in its maximal thickness. Remaining in the sagittal plane, I demonstrate the whole length of the endometrium and the cervical canal, showing the endometrium in its maximum thickness. I ensure that the endometrium and the ultrasound beam are perpendicular. If necessary, I adjust the depth of field, then the zoom, to ensure that the endometrium is measurable. If necessary, I adjust the gain to improve the appearance of the image. I then freeze the ultrasound image. I capture the image, and I keep the ultrasound image frozen. Measure the endometrium in its maximum thickness. I now measure the maximum thickness of the endometrium. I find the thickest portion of the endometrium perpendicular to the endometrial midline. I then place the calipers at the level of the two opposite endometrial-myometrial interfaces. I then capture an image and unfreeze the ultrasound image. To complete the scan, I slowly withdraw the probe, taking care not to exert too much pressure on the patient.